Hello everyone. In this video lecture, we will study the topic HRD in health and family welfare, and the second one is the HRD in voluntary organization. So let's start with the video lecture. First, we will study HRD for health and family welfare. According to the World Health Report 2000, the profession of healthcare involving together considerable number of resources input to deliver an extraordinary array of different services. For example, the manufacturing processes match the variety and the rate of change of production possibilities in health. So there are the three principal health system inputs. First one is the health resource, second one is the physical capital, and the third one is consumerables. In health, human resource development or the Department of Health Research is intended to create a pool of talented health research personnel in the country by upgrading the skills of faculty of medical colleges and institutions and mid-career scientists, and also about the medical students, etc. The specialized trainings are basically provided to the health researchers, leading to the national and international institution, and it also helps to encourage and support the trainees to develop and take up the research project for addressing the critical national and local health problems, and also provide the financial assistance to the institution for upgradation of infrastructure to enable the such institution to provide the training with state of art technology. The scheme of health and family welfare in HRD, this was approved during the 12th 5-year plan period with the following objective. The objective of 12th 5-year plans are: first one is that to increase the overall availability of trained personnel for health research from medical colleges all across the country, so that the scholarship, fellowship, and career advancement schemes, etc., may be provided to the faculty members and young medical doctors and other scientists to take up the medical and health research as a career. And the second objective is that to focus on the creation of a cadre of trained medical and health researchers in specific identified priority areas of health research, such as clinical trials, toxicology, good clinical practices, quality controls, modern biology, biotechnology, stem cells, genetics, drug engineering, etc. And the last third one is that to create and support, nurture, and encourage the trainees to forge the linkage with other scientists from universities, research institutions, etc., to develop the multidisciplinary and multisectoral teams. And the last objective is that to establish suitable online teaching and learning facilities to facilitate the training in health research in various subjects, like these are the subjects, in more effective manner, and for promoting the biomedical and health research. Next topic is production of HR for health. WHO has advocated that countries must ensure that their health system gets the right number of service providers with the right skill to the right place at the right time. So India, having the largest network of healthcare infrastructure and a pool of health personnel in the world, has been debating the issue of relevance and quality of medical education since 1946, when the Bhor committee has given his report. So an increasing number of workforce produces a private and a semi-private institution. So with the regulatory role of medical, dental, and a nursing council is ineffective. There are large varieties in the quality of a doctor, nurses, and other categories that pass out from such institution, including those that pass out of the government-run medical colleges and nursing schools. Another thing is that the National Population Policy has recommended for the modification of undergraduate and the postgraduate medical nursing and paramedical and medical nursing and paramedical professionals, their courses and syllabi, and also about their curricula, in order to reflect the concept and implementation of strategies of the reproductive and child health program, and national population policy. So, despite the provision in the curriculum, pre-service training does not give the doctor sufficient practical learning opportunities to become the skilled attendants of reproductive and child health care. So, in fact, that there is no set standard being adopted by the various medical colleges in the country, resulting in the vast gap in the quality of medical graduates produced. Now, there are a lot of functions which HRD performs in the health sector. First one is the human resource planning, and second is selection and recruitment of health professionals. Next is training programs, performance appraisal, job evaluation and analysis, reward and punishment, transfer, employee counseling and feedbacks, employer relationship, career planning and development. Next is HRD in voluntary organization. Uh, One of the recognized reality in India is that there has been an effort of the government and government sponsored organization and agencies alone is inadequate to achieve the socio-economic transformations of society. Uh, uh, so, over the years, the role of non-profit voluntary organization has increased. Has increased in a variety of fields such as rural development, community development, health and rehabilitation, vocational training, and consumer organizations, etc. The acknowledgement of the need of voluntary organization is reflected in the seventh 5-year plan document. The seventh plan can be implemented successfully only with the involvement of people, and the plan proposes to do this by increasing the involvement of voluntary agencies in implementation of planned programs. Voluntary organization in India range in size from a small group of 5 to 6 peoples individuals to the large organization employing the hundreds of the peoples which are engaged in diverse operations spread across the country. Next is that the few examples of voluntary organization. First one is the Maliwada Rural Development Project in Maharashtra. So this project was carried out by a group of young men working for the Institute of Cultural Affairs, a non-profit international group involved in research, training and demonstration relating to the human factor in the world development. So Maliwada was taken as a demonstration village, and the second example is that Thilonia experiment in Rajasthan. Here a group of youngsters got engaged under the dynamic leadership of exceptionally talented and committed young men, and formed a voluntary organization named as a Social Work and Research Center. Next is the advantages of voluntary organization. The advantages are that the voluntary organization, individuals who are working in the voluntary organization, they have the potential for to be work as an effective change agent. Being a small in a size, they are flexible and therefore organizationally more adaptive. They tends to have the strong ideological commitment to social justice and economic opportunity for all, and empathy for underprivileged sections of the society. Since they are by and large the autonomous in functioning, independent and dynamic, they are able to take up the risk and undertake the controversial activities which the government and the corporate bodies would find difficult. Next is the various HRD interventions in voluntary organization. There are a lot of HRD interventions which are held in organizations. So few of them I am going to to explain here. First one is diagnostic HRD activities. The climate survey, the culture building and culture changing interventions, and team development. These are the activities. And second is the educational training and consciousness generation, systematic mechanism of performance, potential appraisal, and training and development. These are the HRD interventions which must be introduced in voluntary organization. Next is the high degree of achievement orientation, warm interpersonal relation and mutuality. Next is HRD activities such as target based performance appraisal system, activity analysis, task design, and organizational development activities. Next is is that it requires the people with skill and competence which may be common to those of people in other organization, but their attitude, value and motivation needs to be distinctly different. Thank you.